Information about the initial Category 1 certification course. 1. Although 14 hours is the legal minimum time for training, the principles of quality adult learning indicate that additional hours are needed, and that many consecutive hours of training without break times are not effective for information retention. The 14 hours minimum time must consist of engaged learning time in the classroom and does not include lunch and break time. The course may be lengthened to meet the needs of the class participants and/or the RN trainer and employer. Everyone should have their own personal copy of the entire curriculum to use during the course. Anyone can obtain a copy of the curriculum for personal use from the Department of Developmental Disabilities website, departmentofdevelopmentaldisabilities.ohio.gov. A copy of the curriculum must be readily accessible on site where medication is being administered or health-related activities are being performed. 2. To obtain the initial Category 1 Department of Developmental Disabilities Medication Administration certification, developmental disabilities personnel must do all the following: attend the entire program and participate in discussions and activities. Successfully demonstrate performance of the 13 health-related activities and the preparation, administration, and documentation for each route of medication presented in the initial Category 1 certification training course. Pass a closed-book written exam with a score of 80% or better. Personnel who do not pass the written exam with 80% or higher are required by rule to retake the entire initial certification training course before attempting to take the written exam again. Complete and submit an evaluation of this program to the RN trainer. The RN trainer may provide additional time for skills development and/or study prior to testing and determining if the student meets the requirements for certification. After certification and before administering medication or performing health-related activities with any given person, the certified personnel must have individual-specific training about that person. It is the responsibility of the personnel and employer to assure IA has been done. If delegation is required, the delegating nurse must do the IST. Renewing your certification. At least 90 days before your expiration date, plan to complete the required education and skills for renewal. 1. To renew certification requires completing 2 hours of continuing education related to medication administration and/or health-related activities. And 2. You must demonstrate skills of medication administration and health-related activities. Skills must be demonstrated annually to be used. Any skill not demonstrated as part of renewal must be demonstrated prior to performing the skill when needed. If you work at a site with nursing delegation, a nurse must observe your demonstration. If you work at a site without nursing delegation, return demonstrations are performed and monitored by the person designated by the employer. If you are an independent provider, your return demonstration can be done by a county board nurse or any Department of Developmental Disabilities certified RN trainer. The RN trainer attesting to renewal requirements must be sure the person verifying skills and/or providing CE has the knowledge, skills, and ability to do so. What you need to know about your certification. 1. You are responsible for your certification. You must verify that you are currently certified to administer medication HRAs. You must confirm your Category 1 initial certification and renewals on the Department of Developmental Disabilities website, departmentofdevelopmentaldisabilities.ohio.gov. 2. This certification is valid